Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rullan, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rullan is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Welcome to another episode of A Stride Above. Today, for third time in a row, we have Dr. Colton Ramstrom. Thank you very much for being here with us.
Thank you.
And this is our third and last episode on arthritis. If you haven't listened to the first two, I encourage you to go first and listen them and then come to this one, because you're going to learn a lot more on this one. You're going to take a lot more out of it. So let's talk about the difference in the lower limb joints versus the sacroiliac, for example, and how come a horse can get arthritis in every joint there is, even though there's some different joints.
Good question. Yeah, so I think the difference you're getting to between lower limb joints like coffin or even stifle or hip joints versus a sacroiliac joint is the limb joints, the stifles, the fetlocks. Those are synovial joints. So they have that joint capsule, they have the synovium, they have the joint fluid, they have the articular cartilage, versus a joint like the sacroiliac, which is more of a ligamentous joint. So it's bone joint to bone with a soft tissue, more of a ligament in between those, without the joint capsule, the synovial structures. So that's the main anatomical difference. The functional difference is that, yes, you don't have the sliding surfaces of the articular cartilage, or the lubrication of the joint fluid. Mechanically, they're different, right? Difference in range of motion, those sorts of things.
Does that influence the treatment? Does that influence the clinical signs? Why do we care about that?
Yeah, so in some ways it does, but in a broader sense, I don't think it really does. You can still get arthritis in the sacroiliac joint, just like you can get arthritis in the coffin joint. Treatment management is largely the same, right? Trying to control the inflammation in all of these processes. So yeah, management's fairly similar.
Do you think that does it make a difference, right? Because we think about the sacroiliac joint, and that is embedded with a lot of muscles around it, very strong muscles. While if you think of the fetlock or the coffin joint or the knee, there's not a whole lot of muscles around it, right? There's just a little bit of skin, and right there is the joint. So when you have a problem with the sacroiliac, which is a very large structure, how do we guarantee that we're actually there? Like, people ask me, how do you know? But there's no way that you know you're exactly in that spot. How do you do it? What is your secret
For treatment?
Yes.
Ultrasound. Every time.
Always?
Every time.
Right.
Every time. Yeah. Like you're saying, you have hundreds of pounds of soft tissue that you're going through to get to the target point, the sacroiliac joint, or any of those other structures that you're trying to treat. We're using 8-inch needles on some of these. If you're not using ultrasound, you're not watching your needle go into your target, you could be anywhere. You're doing a deep intramuscular injection if you're lucky, or potentially putting it in a structure that you really don't want to be sticking needles into.
Yeah, I do the ultrasound too, and I have heard horrible stories of some people not using ultrasound and getting in, like you said, the structures like the sciatic nerve. What else can we get? The rectum, right? We can get the rectum, sciatic nerve. It surprises me how a lot of our colleagues don't do it with ultrasound, which I'm not saying is bad, it's just I'm not that good finding the joint without the ultrasound. Agreed. Right? I remember this story, another story. I just came out of a conference with a very popular veterinarian from England. Her name is Dr. Dyson. And she really promotes blocking the sacroiliac joint. And at the same time, I read a paper on how you can inject the sacroiliac joint without ultrasound. So what I did is I went in, and the owner was holding the horse for me, and I was just very young, coming out of my internship, out of this conference, and I go on my approach, and I injected a very large amount of carbocaine. I injected about 20 cc's of carbocaine to evaluate the lameness. Everything went well. The horse came out of the stocks, and about 5 steps later, went into the ground, just like that. And after that moment, I don't block sacroiliacs, and I don't inject them without ultrasound ever, ever. So let's go further cranial sacroiliac. We have, how about the back? Did you ever inject the back?
Frequently.
For what problems?
You can have, well, let's start with the anatomy of the back,
Mhm.
right? There's joints, ligaments, muscle attachments. Again, the added complicating factor there is that you do have the central nervous system inside the back. The spinal cord, you have the nerve roots coming out from the spinal cord going to the rest of the body. So makes doing nerve blocks in that area potentially a little bit complicating, just like you were just describing with that story. As far as problems that we see in the back, kissing spines is something that everybody's heard of. You know, dorsal spinous process impingement. But you can also get arthritis in the facet joints. So
What's a facet joint?
that's the articulation between two opposing vertebral bodies. So each vertebral body has four technically, but a process that comes off and articulates with the vertebral body behind it and the vertebral body in front of it. Those processes form the facet joints. So you can get arthritis there, and then obviously muscle soreness, and any ailment that you can get elsewhere where you have similar anatomical structures you can see in the back.
Yeah. And all the manifestations for this is back pain.
Not always.
Oh, tell me about it.
Could be stiffness, could be some change in performance like we were discussing on in previous episodes. But yeah, a lot of the time there is a certain level of discomfort or pain that's resulting in these other issues.
Acupuncture versus joint injections for back pain.
Acupuncture versus joint injections. Good question. I use really big needles when I do acupuncture, typically with medication.
Okay.
I'm not trained as an acupuncturist, so I don't have much experience there, but people say it works.
Yeah. I do not have any experience with acupuncture as well. I do know that there's a science behind it, and there's some research behind it. But our preferred method is going diagnose, find out exact problem, and going treat it straight into it. It probably will be a good adjunctive therapy.
Absolutely.
To do acupuncture with.
Absolutely.
And so those chiropractor, we work many horses with our chiropractor, Dr. Chris Burnham. And how does that work for you? Any opinion? Good, bad, indifferent? What you thought?
Very good. Very good. I think that, yeah, working with a good equine chiropractor, also body workers that they can definitely, be part of the treatment team. And I found with a lot of the cases that Dr. Burnham and I have worked on, he'll send a horse to me, I'll treat it. He'll go out and see it again. His adjustments are holding longer. The horse is performing better. I see it again. And it's very much a synergistic relationship that we can develop.
Yeah, I agree. Bear in mind that there is not a whole lot of scientific research in chiropractor, but there is some, and they're coming up with some very interesting research in human and in horses. And we clinically are also seeing a good synergistic relationship that, like Dr. Colton is talking about. Well, look at that. 10 minutes already. Our time is up. I hope you learned something interesting today from Dr. Colton. If you have any questions or comments, don't forget to reach out to us, DM us, and if you have a good to say, please give us a review, okay? Ace right above. Thank you so much for being here with us.
Thank you.